Look at the picture on the left. Guess what the production is? Don't worry, let me tell you. It is Trilaciclib, the leading role today. It is a magical myelosuppression drug which is now known in the world. Then, I will introduce this drug to you. You can see what it look like on the left. Trilaciclib, or G1T28, is a CDK4 and CDK6 inhibitor indicated to reduce the incidence of chemotherapy-induced myelosuppression in patients before topotecan-containing or platinum and etoposide-containing chemotherapy for extensive-stage small cell lung cancer. CDK4 and CDK6 inhibitors have been investigated since the mid-1990s for their use in tumorigenesis and chemotherapy. Trilaciclib was first described in the literature in 2016 January and was granted FDA approval on 12 February 2021. When you are undergoing chemotherapy, you take anti-tumor drugs. It of course attacks the tumor cells, but at the same time, it attacks your normal cells as well. These include your stem cells, or in other words, HSBC. If these cells die, you will suffer from a marrow suppression. One phenomenon of the marrow suppression is a decline in the white blood cells. As the white blood cells play an important role in humans' immunity, your ability of immune will also decline. This is a very severe situation. But there are ways to solve the problem. Trilaciclib can provide comprehensive bone marrow protection for patients and reduce the incidence of bone marrow suppression after chemotherapy. And except for protecting the white blood cells, there are other functions of trilaciclib. It activates T cells and deprives Treg cells, which both enhance your ability of immune. And it helps your body express more anti-tumor gene, which means it helps you fight against the tumor as well. So how do this magical anti-bone marrow suppression drug complete its task? Let me tell you. Look at the picture on the right. It shows the mechanism of the trilaciclib. You can see CDK4 and 6 is essential for a cell to enter the S period. Trilaciclib inhibits CDK4 to prevent the cell from entering the S period. Thus, the cell failed to finish the mitotic division. When a patient is undergoing a chemotherapy, the chemical attacks all the cells, including those in the bone marrows. Trilaciclib prevents the HSBC from dividing and protects them from being attacked. It has many advantages over its three competitors. Its first advantage is it is very convenient to finish an intake. You need only an injection 4 hours before your chemotherapy. But for other three drugs, you have to take it over and over again for 21 days and then stop 7 days before your chemotherapy begins. So it's very inconvenient, and patients do not like this a lot. And the second advantage is it has a much shorter half-life than other drugs. This means the drug seldom remain in your body after a long time. Or otherwise, your body may fall ill due to these drugs because all those drugs are little toxic to the body. You only suffer from a little discomfort when you are injecting this trilaciclib. But if you take the other 3 drugs, they are very toxic to your blood and you may suffer a lot more. And look at these five side effects. Trilaciclib has none of these 5 side effects, but its competitors has at least 4 of them. And some of the side effects are very severe and can sometimes be fatal. So we say trilaciclib is a very capable drug. But despite the fact that trilaciclib is very capable, some people are not advised to take these drugs. It can only be used for patients with extensive stage small cell lung cancer who have not previously received systematic chemotherapy. It is administered prophylactically before treatment with a platinum-based drug combined with etoposide regimen to reduce the incidence of chemotherapy-induced bone suppression. Based on its mechanism of action, the use of trilaciclib during pregnancy may cause fatal harm. We should be aware of the potential risk to the fetus when administering the drug to pregnant women. Although there are no clinical data or animal trials to assess the risk, you'd better not inject this drug to the pregnant because though the risk is not known, it does exist and can sometimes be very harmful. I will offer you some other information about this drug. Absorption. Cmax and AUC of trilaciclib increase proportionally with dose. Volume of distribution is at steady state of 1,130 liters. Protein binding. Data regarding the protein binding of trilaciclib are not readily available, and data regarding the metabolism of trilaciclib are not readily available as well. However, it is expected to be extensively metabolized. Then I will introduce the role of elimination in your body. 79.1% of our radio-labeled dose is recovered in the feces, 70% as the unchanged parent compound, 14% of our radio-labeled dose is recovered in the urine, and 2% as the unchanged parent compound. Its half-life is approximately 14 hours, and the clearance of trilaciclib is 158 liters per hour. That's all. Thank you for watching.